Hello everyone, I'm so glad to have you all here for week 2 of the class. I just wanted to check in about how the first week was doing and how everything is going. Please feel free to send either of us any emails if you have any questions, or try to give us a call. If you've not had time yet to evaluate the needs of your library and your community with assignment 1, I understand it's a very chaotic time, but I also want to talk about why it's so important that we do this first. We sometimes have a different view of what we think the needs of our community are, and in particular our most vulnerable individuals. So sometimes it can get skewed, and right now we haven't really been working with our customers in the same way for probably 6 months, so it's important for us to take a step back and really look at not what is impacting us in particular, but what is the community asking for? What are they wanting and needing? So if you're able to, I highly encourage you to take the time to look at any data that you have, any quantitative, qualitative. I understand, if you don't have numbers, look for things like customer comments, police reports, staff comments, incident reports, demographics of your community, whatever you have access to either within your library or maybe through the police department, through your city, through Googling your city and seeing what maybe the last census said. Take a peek at those different things and maybe what's been changing in your community, and that all kind of comes together to form this true picture of what your library needs are and where opportunities are for your library to offer service. Don't be afraid to maybe identify even some of those needs that you're not able to address. We're just working on painting that whole picture right now, and maybe things will surprise you. Maybe you'll find something that you can address that you didn't think you could. So, like I said, try not to focus on what is directly impacting you, but try to focus on what is impacting the community and what the community is asking for. So that's why we take that time first to really address and look at what it is that the data is saying. So now we're going to move into this week a little bit about why we want social service collaboration. We're going to talk about some common philosophies in social work and how they compare to philosophies in libraries, and how these two approaches can work together in a variety of different ways. We'll talk a little bit about the application of these approaches, but we'll go more into depth with that next week, along with approaches that you can utilize with your library right now. I want to make sure that we have time to truly think about our community and what those needs are, and start to mull over the different ways that these collaborations exist and what might be applicable for you and your community, what resources might already be there, and then we'll dive into change later. So these next 2 weeks might have some content flow overlap, but we'll dive deeper into anything next week that we talk about this week. And I also want to apologize to anyone who does already know some of these content and concepts and philosophies that I might discuss, whether it be through past trainings or your own personal education, whatever it may be. We'll just hopefully see that everyone can take away a little bit more from this than what they knew before. So briefly, I want to discuss how my position came to be. Every single library has different needs and will apply what we discuss in different ways, but this is just one example of how we arrived to where we were at and what we needed. So in the fall of 2018, our library was approached by city board members about the possibility of creating new library positions that would meet the city's goals of connecting with and assisting community members in new and innovative ways. The focus was primarily on how our community members that are experiencing homelessness, low income and impoverishment, lack of affordable and safe housing, and how that was impacting the community, both in morale, in visual appearances, in discomfort that people had, and also just wanting to serve all of our community members equitably. So our director was able to create 2 proposals from that, an early literacy specialist and my position, the community resource specialist. They had weighed some of those options between responding to behavioral concerns in the library with a security guard, and ultimately they decided that a proactive approach would be better for the community and the community's goals. As a library social worker, I have a very versatile position to respond to customer and community needs, and that has been so interesting and important during this last year. My goal has really shifted away from serving directly those individuals who are experiencing homelessness or other urgent needs, and providing support for different community organizations that are serving those individuals in different ways right now, to providing support to staff in more extensive ways than before, and just adapting and finding that our community maybe needs some more mental health education and support. So my position has thankfully been able to be very versatile in that way. So I look at my position as a community-based social worker. I work on a micro to meso level, and we'll talk more about what that means in a minute. And I provide low barrier opportunities for individuals to receive assistance with their life challenges. So this is a city-funded position in our case, and no customers are billed for accessing this assistance. And because of licensing standards, this service is entirely confidential unless there is a significant safety concern for themselves or others, as I am a mandated reporter. And so that does tie into the different ways that people access these services, whether or not the individual is a mandated reporter. And at the end of this, we'll talk about the different opportunities that you might have to have a social service collaboration, and maybe which ones do and do not have any type of mandated reporting requirements. So for those that are wanting to know more about creating equitable, inclusive spaces, I really want to dive into mandated reporting briefly, and it's important and helpful for marginalized groups to know that the library is a safe place for people who may be concerned about their undocumented immigration status, their gender identity, sexual orientation, maybe fear of a caseworker or probation officer finding out that they've relapsed, or possibly someone in a domestic violence situation who needs a safe place to go to talk without their abuser questioning where they're at, because they can legitimately say, I am going to the library, and if their abuser were to drive by the library, they would see that indeed that person is there. So all of these have been reasons that I have been given as to why someone sought out services at the library instead of at another community resource. So there are so many reasons why those in need are seeking the safety of a library versus maybe going to another service provider first. And this is just a quote that I had received from one of those individuals, specifically about their identity and receiving services. So having social workers in libraries has been an emerging trend around the United States. 11 years ago, San Francisco was the first public library to hire a social worker to address the ever-growing needs that their customers had and that the librarians were not trained to manage. So now there are at least 44 libraries in the United States, one I believe in Australia and a few in Canada that have hired social workers. 5 libraries at least have a part-time social worker, 18 have social service office hours that they host, and 60 libraries have social work internships. These numbers are probably out of date from the last time that I looked at this, as this profession is extremely hard to track and also emerging very quickly. So this creative approach to meeting people where they're at is working, and that's why it's growing so quickly. It's a proactive way to assist customers rather than being reactive to behaviors that are not congruent with the library environment. So why social workers in the library? Well, as you all know, you all have passions for libraries. No one serves people quite like a library does. It's a free, safe, and sheltered place. We naturally can empower our clients on a micro, meso, macro level from this basically bouncing block right off from the library, and it's really an amazing opportunity to work in the community in this way. And social workers work against oppression of disadvantaged, stigmatized, and underserved populations, and they attempt to address the needs of the whole person. So it's really just a awesome way to connect these two professions together and to have someone in the library environment that can take things a step further that librarians are not trained to do and should not have to be trained to do. right? There's some individuals who do seek out dual training, and that is great and amazing. But at the same time, right, we want to make sure that people still feel safe and comfortable with what they're doing, and this has just gone together so perfectly. So these professions just naturally overlap. As you can see, there's some exact verbiage in our core values that are similar, such as service, and things like competence and social work directly associate to professionalism and education and lifelong learning. That's in librarianship. And really, truly, we all want to provide service, and providing it in innovative ways and making sure that individuals feel supported and connected to. We're just doing them maybe in slightly different ways. So this overlap just came together very naturally because of the fact that individuals were seeking services in libraries already. I've heard some of you already saying things about how customers are getting advice to come to the library to ask for help at computers or whatever else it may be, but the librarians are not trained to follow up with and actually do some of the things that are expected of them. So there's a little bit of a disconnect, right, with the community and their expectations of libraries, and social work can help fill the gap in some of those different areas. So whole person librarianship is something that I want to briefly talk about, and like how these approaches can be used together. And a former professor of mine actually wrote what I believe is the first book on applying social work approaches to library services. So together with a librarian, they made this collaborative webpage that turned into a book about connecting people that are in this work and sharing their ideas. So if you're interested in learning more, be sure to check out wholepersonlibrarianship.com. This is just one of a very few resources that we have for social service collaboration. We also have a newer resource with just over 200 members with the Public Library Association Social Work Interest Group. So they're slowly building some momentum with some webinars and some other resources and guidance that the Public Library Association has put together regarding social service collaboration. So why does this approach work? Why do we keep coming back to it, and why are more and more people catching on? Well, we'll start a little bit with a social work philosophy, and that philosophy is person in environment. So this approach is understanding that an individual and their behavior are based on environmental contexts in which they live. So this perspective directly informs our practice and how we do our work. We focus on historic and current issues of oppression, privilege, and discrimination, and consider how these issues are impacting our clients. We consider how behaviors are often a product of the environments surrounding a person. So for example, when we consider that a person's family has been in poverty for generations, and also consider how each of those generations learn the rules of society, we may see that they did not learn the same thing that our own parents might have taught us about how loud we speak in a library, for example, or if it's acceptable to roll tobacco in a library, or any of the other maybe common library rules that get broken. We also consider that there are these influence that might be on a person in that moment. So maybe they've been having an awful day, week, month, year, whatever it may be, and they're coming to the library to escape, but they're not thinking about the library standards that they need to meet. They're thinking about getting their needs met in that moment. So maybe they brought with them their only meal that they received that day, and they're so excited to eat it, but then a librarian states it has an offensive odor and they can't eat it right now. So then it erupts into something bigger because they're trying to get their basic needs met, and then they were prevented from doing that. So we're thinking about all those things that maybe went on up until that explosive moment, and helping redirect individuals in a different way so that we don't have issues that come up, hopefully. We can't prevent them all, but it helps inform our practice by considering all these different factors that might be going on for a person. So we also believe in meeting clients where they're at. So this looks like providing resources that a person is ready for, for example. So just because someone may not have a job, maybe you know that they don't have a job, it's not providing them a job resource until they're mentally ready to take on that resource. It's not up to us to decide what they need and when they need it. We can just be there as support and guide them until they're ready for that resource. So if they're telling you that today they're wanting a resource for a local gaming group, then that's their self-determination and their mind and body saying their social needs are more important to get met first. And maybe that will bring them to a point eventually where they are ready to take on another task like job searching. So while meeting clients where they're at is typically meant, that we're literally meeting them where they're at mentally, we're putting a social worker in a library to take it, again, very literally and bring that resource directly to the client and meeting them where they're at here. So this is where library and environment comes to play. The library plays a critical role in the community, and it can be used as a tool with your help to interrupt the systems that are negatively impacting our customers. So when customers are facing life challenges, a referral to a social worker can get customers connected to supports that they need, which in turn will create a greater connection to the community and in turn a greater relationship with the library. So this is truly a wonderful cyclical effect that can happen when we consider how applying this approach can work together to improve the library and not just to mitigate concerns or anything else like that. So let's dive a little bit deeper into how this is applied. So on a micro level, social workers work one-on-one with clients to empower them to make changes that they desire in their lives. So I do this by connecting clients with supportive community resources, helping them overcome language, literacy, and mobility and cognitive barriers that are inhibiting their progress, working with them on goal setting, and keeping them accountable on their journey. So this all comes together as case management, and I define what I do as light case management because there's no contract between myself and my clients, and they're able to leave my services whenever they want. And the length of time that I work with individuals is typically a lot shorter than what most formal case management looks like. However, that's a variable depending on the person and their needs. I also like that this micro work is set up in this way because, again, it allows for that flexibility. So maybe there's no one in your community that can answer a question about how to create a will, but guess what? The library has books about how to create wills, and the social worker can offer a template, and then together you can sit them down on the computer to have a fill-in template that they can create their will. So it just comes together naturally on that micro level to get those varying needs met that are not being filled elsewhere in the community. So next, on a meso level, this is working with groups and organizations to do community-based work and assistance. So this can look like local policy changes and advocating for accessible services and having policy and procedure changes within your library or other organizations in the community. This can look like a lot of different collaborative efforts, such as connecting with schools, especially around this time of year when kids are starting to go back to school and there's a greater need that might come up for some of those vulnerable families. This can look like working on committees with local initiatives like low literacy and homelessness, and this can look like educating doctors on how to best provide services to vulnerable patients. It can really be all over the board, and that's why it's such a unique way to adapt to the community needs, because you're utilizing who you have in the community and working together to accomplish common goals. So for example, you might not initially think that ending homelessness is a library initiative, but when it's our customers that are hanging out in the library every day because they have nowhere else to go, it becomes a part of our initiative to assist these individuals in having a place of their own so that they can start to use the library as something for pleasure rather than something out of necessity. By engaging in these community initiatives, we can work together to uplift our customers and improve the way that they access the library. This is why I ask that you really take that time to evaluate the needs of your community, because it might surprise you what roles the library can play. So lastly, we have macro social work, and this is less common with library social workers, but it is still something that does get utilized occasionally. And this is where social workers work more at a higher level, large scale for systematic change by advocating for laws and policy changes, and sometimes even the creation of new organizations to address community needs. So this is probably going to be less applicable for most people, but like I said, it's still something that exists, and if you feel that it's something that might apply to your area of work or initiatives and needs, I do know one social worker in particular that does a significant amount of macro-based work. I barely dabble with it, but it's considering some of those things like, gosh, maybe we need like a tenant landlord resource center in our community, or maybe we need some type of adult education classes that we don't have offered in the community, and it's building up and advocating for creating a whole new organization or set of people, or where we could place it in the community in order to get people's needs met. So sometimes it does occasionally apply to our work. Okay, so how do we actually get this into a library setting? So here is a non-exhaustive list of social service collaboration types. And for example, it could be someone like me who is employed as a social worker in the library. Sometimes library systems will employ a social worker or multiple social workers to work across a number of libraries. There are sometimes cases where maybe a whole system doesn't employ the social worker, but one or two libraries employ the social worker and split their time between them. This can be done via grant funding or city funding. There are also contracted social workers by the library or library system. So often what I see are health systems, so major clinics and hospital systems are employing social workers or therapists to be placed inside libraries. So doing drop-in mental health clinics and offering that, or doing the work that I do in libraries as well. There are also dually trained librarians and social workers, and this occasionally can cause some conflicts, but for the most part it has been successful. The one thing where this can be a little bit of a conflict is that I found that librarians actually have a stronger sense of confidentiality than social workers do. We very, very much believe in confidentiality, but we have a point where we have to mandated report, whereas librarians don't, at least not in the state of Wisconsin. I'm not sure where else they might potentially have those changes, or other countries, but that's one area where conflict might exist. But for the most part, especially in smaller towns, having a dually trained individual can allow for more adaptability in services and what's provided. Also, where some of that adaptability can occur is having a peer navigator. So maybe you don't want someone who is a mandated reporter, and that's sometimes okay. So again, having someone who with lived experience is typically a peer navigator who can talk to an individual about what relapse is like and moving through the steps of recovery, and maybe someone who is an undocumented immigrant who maybe made their way towards being able to be documented, but still being able to have that connection with an individual who is undocumented and feels safe to talk to. This can happen a lot with language barriers. Peer navigators can be helpful, or cultural barriers. Anyone with any type of lived experience can be beneficial in being a peer navigator, and this can cover a variety of different needs that we might discuss. So then there's also social work students. So interns can be placed inside libraries with or without an employed social worker. So they may have to get their supervision at their college or their university in order to make sure that they're following all of the legal needs that an internship might have. But I've seen it to be very successful to have students learning. They're working very intensively on different projects. Typically this is more a project-based activity where they have a specific 5-month goal, what to accomplish in that time, and what needs they want to address. So it can also be more what I do, but it makes it harder to have continuous work when they're only there for 5 months, or if they're a master's student, they might be there for up to a year. And that's okay. It's just knowing that there are some interruptions and how to work with them. So another way to do some of that project-based approach is to have service learning opportunities for students. So this might not necessarily be just social work students, right? If you have, if you want to have a work on a car workshop, learn how to work on a car, maybe you have a bunch of mechanic students that are willing to teach people and help them work on their vehicles. Or maybe it's a mental health workshop that is run by psychology students. Or I've heard of libraries that do food pantries and run food pantries, and that could be any number. It doesn't have to be just social work students, but anyone who cares about service to their community might be interested in running the library's food pantry. So there really could be any number of, again, project-based type things that could fit into this category. And yeah, I mean, the options are endless, but again, you might have inconsistency in the number of individuals who are interested, and being able to maintain that can sometimes be difficult, but sometimes that's okay, and sometimes people are able to ebb and flow with that, and that works. And then again, with each of these options, you have to consider supervision. Is there a librarian, multiple librarians that are going to help, manage volunteers, or are these project leads, and go from there. And another one that we can talk about is hosting social service for office hours, events, series, public education, etc. So this is where you have maybe a workforce resource comes to the library every Monday from noon to 7 p.m., whatever it is, right? And so people know that they can come to the library to file unemployment. During that time, there will be someone there to help assist them. And that can be really beneficial if you have a common question that comes up that you're constantly feeling like you're not trained to meet the need of, and B, you don't have time to meet the need of for individuals. So bringing someone in to meet that need. It can also be just like strictly open, just open office hours where maybe your local Department of Human Services is willing to have ask a social worker, anything, right? It doesn't have to be specific agencies. It could be ask a social worker anything, hours. And then there's also been libraries that have done really great events and series of events related to mental health and wellness. Maybe it's related to health and healthcare, so STI testing, or different types of screenings. Having individuals come in for diabetes education and screening. There could be a number of things that could be hosted in the library, and maybe you think, that seems weird. I don't know if my library is ready to do something like that. But just remember that libraries are places where people are at, and you can increase the health of your community by providing better access to those screening tools. And add some education along with it. It really is a cool way to combine everything together, and the community will appreciate it. So lastly, talking about staff education. So I do a lot of staff education, but sometimes it's better to bring someone in, and maybe you have you need to get your staff caught up on LGBTQ lingo and how to serve that population best. Maybe you find someone at the Gender and Sexuality Resource Center, or whatever it's called, at your nearest university that might be able to come in. Or maybe you're lucky enough to have a Gender and Sexuality Resource Center in your community and that person's willing to come in. Or maybe you're wanting to talk about domestic violence and sexual assault, and just having someone come in to talk to staff about how to respond if something like that comes up. Because I feel like a lot of times when those traumatic type things can come up, our gut reaction is to freeze, and we don't know what to do. So just getting a little bit of training to say, it's okay, and to have some of that reflective listening experience and practice can be really beneficial for staff to have, so that they feel a little bit better prepared to say, wow, wow, what you're going through right now sounds very hard. I think I actually know of someone who you might be able to talk to more about this, and then giving that resource referral out. So knowing that it's okay, it's okay not to know and not to have the resources and information for everything, but just to be able to know who to talk to next, right? So it's, I can't really, I'm not trained to listen to to listen for, about all these complex things that you're dealing with right now, but I know someone who is. And being able to say, but I know someone who is, or I know an organization that is such an empowering thing for your staff to feel a little bit less helpless during challenging situations. So I ask you just to take some time and think about, what is your community ready for? What type of collaboration might be able to fit into the way that you're doing things? What funding exists? What type of resources can you pull from to help meet these needs? And maybe it starts somewhere small, but maybe you can do something really big and you're wanting to try for something really big, and that's okay too. The worst thing that can happen is people say no. And consider and push yourself a little bit and see, what is it that you're wanting to address, and let's start to pull together some of those resources and ways that you might be able to address those issues. So I'm going to talk a little bit more about that, and if you have any questions, again, feel free to please email me and connect with me about that.